Is this permanent?
Unlike microblading or other popular cosmetic tattoos, which uses semi-permanent inks, the inks used are the same inks used in traditional tattoo. Once the client has achieved their desired coverage, results can last anywhere from 5+ years without ever needing a touch-up.
How many sessions are required?
Every client is different, and how their skin responds to the treatment will also vary. Because scar is damaged tissue, the skin is more delicate and often requires multiple sessions to achieve optimal results. In general, most clients need a minimal of 2 sessions. I always tell clients to plan for at least 2 sessions and honestly not to evaluate the results until after the second session. The first session is sort of like a primer.
How long does it take to heal?
Healing time varies due to a multitude of factors: age, diet, overall health, skin tone, elasticity, sun exposure, following aftercare, etc., etc. On average, it takes 60 to 90 days, but often takes longer for clients who are prone to hyperpigmentation or have underlying issues like diabetes or obesity. Remind clients that results are not overnight, but they are definitely worth it.
What happens when you tan?
The ink is deposited into the dermis, the second layer of the skin that is not exposed to the sun, so there is no risk of the pigment changing color due to sun exposure. The healthy skin will tan as normal, but because there's no longer a color contrast, the camouflage area is less noticeable. Clients should avoid sun exposure for 40 days after treatment and apply sunscreen to maintain their results.
Why is this method unique?
This method promises the best solution to conceal the color contrast between healthy skin and light striae. Because the stretch mark is thin and sandwiched between healthy skin, there is little possibility to distinguish between the skin and the pigmented stretch mark. The procedure is low maintenance, has minimal to no pain, and requires little to no downtime.
Does this hurt, and do you use numbing cream?
Numbing creams are not recommended in this procedure since they alter the color of the skin, making it more difficult to see the scar for proper pigment implantation. In general, because the same needle is used throughout, clients are capable of tolerating the procedure and describe the pain as more of a discomfort. People generally fall asleep.
How long does this take?
The longest portion of the session is matching the client's skin tone. In general, the procedure is performed in 2 to 3 sessions at approximately 2 to 3 hours per area, depending on the size of the area involved.
Does this work on deep or wide stretch marks?
Yes, as long as the clients are aware that the procedure will not smooth the skin or make the stretch marks disappear entirely. However, the procedure will improve the color of the stretch marks and hide the contrast between the surrounding skin.
What if a client loses or gains weight?
Changes in weight can affect the appearance of the tattoo, and the recommendation is to get the procedure when the client's body weight is stable. If subsequent changes happen after the procedure is complete, retouching the area is an option.